Earth, our Mother Earth, a long travel in the universe, a long universal voyage, a story of creation and development, but also an enormous and endless series of disasters and catastrophes. Since the beginning of Earth time, major events have been recorded which have changed its face and its destiny many, many times. Throughout recorded history, humanity has faced disaster, painful and sometimes with success, that is finally overcoming the tremendous consequences to reorganize and continue on its course. But disasters did not end there. The last decades humanity has experienced many times and all over the world their devastating effects. In their aftermath, the world has addressed, among other things, the effects of civil strife, armed conflict, population migration, economic collapse, and famine. Civilians have been targeted deliberately. Populations affected have faced severe public health consequences. Aside the displacement, damage to health, sanitation, water supplies, housing, and agriculture, they have also led to a rapid increase in malnutrition and communicable diseases. Thousands of people have been killed because there was no cure or no cure handy. Lack of adequate clean water and sanitation, timely measles immunization, simple treatment of dehydration from diarrhea, supplementary feeding for the malnourished, micronutrient supplements, and the establishment of an adequate public health surveillance system had devastating impacts. Antibiotics once cured diseases like tuberculosis, but do not always have the same effect today. Old enemies like polio refuse to go away. Others, like smallpox, threaten a devastating comeback if released, while some diseases still do not have a cure nor a vaccine. New ones have been identified, with scientists warning of a possible worldwide epidemic involving a killer virus that they believe does not even exist yet. The World Health Organization has warned us of the coming threats, of the coming disasters. These devastating results will unfortunately continue to strike, causing untold damage to the earth, to the peoples. Public health-oriented response has given many answers, but this is not yet enough. We know we must intervene, but how, we are not sure. This is the question. Certainly, we need much more drastic action. We must start now and undertake it with a new and universal mindset. A healthy, well-protected society best optimizes production and equality. We need a truly universal and catalytic intervention in managing the disasters or the effects of disasters. We need a global renewal of disaster management with emphasis on the health of the public and on international health diplomacy. They push towards the development of a system which will promote a global public health disaster management system supported by the new United Nations Security Council. Public health is the key. Our experience also indicates the development of a system which will use the language of health as the only cross-cultural lingua franca, and it can be used in foreign policy, in health politics, and in health diplomacy. Public health, with its face of friendly neutrality, is a most useful instrument for reconciliation and a different strategy for appropriate socio-economic development. Disaster has not only public health consequences, but a great impact on economic or political stability, on trade, tourism, access to goods and services, and of course, on demographic stability. Can politicians find the courage, scientists the imagination, and society the understanding to support public health disaster management before their effects or the effects of disaster spiral out of control within a vicious circle? Public health response is an answer, but it is not an easy answer. What to do is a simple question, but what to do is a difficult thing. Solutions must be given in prevention, detection, and effective response to infectious disease threats and accidental or intentional releases of dangerous pathogens. Potential burdens of migration activities and the segments of the population most affected must be addressed. Priority setting, rationing, and triage, all involving coercive measures, must be well established during health emergencies. There is no time to think about it at that instant. Complex ethical and social values invoked should be examined before such measures are implemented. Vulnerabilities in each country must guide the development of specific systems, policies, and procedures development. Real-time biosurveillance and effective modern diagnostic systems must be developed. Countries must develop public health emergency operations centers functioning according to standards, international standards, good training, and functioning demands. In other words, public health preparedness must become central to the public health mission of all societies and reflect modern public health security systems. Public health agencies must develop advanced response mechanisms which will permit not only countries alone, but for large geographical areas, regions, to respond more effectively. But the response is a difficult task for poor countries because of weak infrastructure and inability of the people to move to safer places. Local medical services may be disrupted and require international help. The rehabilitation needs of disabled citizens force the response teams to take into account the international aid which assists national and local authorities in routine medical and surgical facilities, such as the effectiveness of international surgical teams, must be addressed. For example, the complex issue of survivors with crush injuries demands international aid and provokes coordination issues in complex circumstances with international aid organizations and agencies. Threats to health caused from the mass movement of people away from the scene and into inadequate temporary facilities must be addressed. Also, difficult questions about sustainability and appropriate use of limited resources arise. But in order to achieve all these global health security issues, we must first strengthen many other things. In order to achieve the highest possible level of global public health security, all countries must fully implement international health regulations. We can proliferate from safety, know-how, technologies and materials in order to strengthen and secure public health infrastructures and effectively anticipate and respond to disaster and emerging threats. They can bring public policy sectors such as health, agriculture, trade and tourism, and legislation in line with the new health regulations. They can increase resources for security training, surveillance, prevention, and for response campaigns. We know that public health security depends on actions to prevent and respond to threats that endanger the collective health of the global population. Global public health security covers a wide range of complex and daunting issues, including the health consequences of human behavior, of climate change, of weather-related events and infectious diseases, as well as from natural catastrophes and man-made disasters, all of which are on the rise and discussed here. It outlines the activities required in order to perform the collective response across different regions and nations, with tens of thousands of people being transported every day. Contagious illness as unprecedented opportunity to spread farther and faster. Lack of a global public health security system may also have consequences in terms of economic or political stability, trade, tourism, access to goods and services, and demographic stability.